Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, 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 ATHLers. Welcome to our Tuesday show. My name is Abby Tyler. I am your host. Uh, please welcome, please share the show, share the show, share the show. As you can see, today's topic is PCOS awareness. This month, September, is PCOS Awareness Month. What is PCOS? It's polycystic ovarian. It goes ovarian syndrome or ovary syndrome. So you can go either way. Okay, so and I got this idea to do this show because one of my good friends, Kaloba, she said, "You want to talk about this?" Because she saw this video where they're doing PCOS awareness, Liberia. I did try to reach out to the people in there, but they didn't get back to me because I wanted to get a personal story. But I do have a special guest who's going to be doing giving personal part of it. She does give me on camera right now, so hopefully the microphone will work in the background, and we'll be getting to her soon. So again, my name is Abby Tyler. Please share the show. Please give me a thumbs up. Please share the show. Again, like I said, I'm trying to raise money. If you can, send me stars and also raise money so I can put this back into the show, I'd appreciate. But the most important thing is to share the show. So in case if somebody else can relate to it, can be relevant to a family member, a friend, or somebody. This show today is for women, it's for young girls, for the fathers, for husbands, and everybody. It's not just a woman show. Okay. And also, my quick disclaimer as always, I am a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider. Okay. So, let me get in here. We're going to go there and go in there and say, okay. So, let me get Julie. We'll be going back and forth. I'll be giving some information and then Julie's going to be giving us a little bit of background. So, Julie, can you hear me?
Yes, I can hear you. Can you hear
Okay.
me?
I can hear you. Hopefully, let me just go in here and see maybe the audience can hear too. Okay, so anybody who's watching too, if you can hear Julie, please just kind of click there, say yes, we can hear Julie. But Julie, can you just give for anybody who knows she was on our show before talking about stroke here, but she's on here now. It's like a personal story about her background too. So can you just 30 minutes introduce yourself and then we can go on from there.
Hi, my name's Julie. I I'm a nurse. I don't know what I'm supposed to be saying. I'm a nurse. I work as a stroke and heart failure coordinator, but I am someone who has PCOS. I'm 40, going to be 47. I got diagnosed around 35 years of age. So I probably had it like my whole life, but I've been aware of it for the last 12 years.
Alrighty, so we'll get more into and you got diagnosed really late into it there. Okay, so again, what is PCOS? PCOS one is gynecological, meaning your reproductive, and also I talked about your thyroid before. If you missed that, I told you how the thyroid's right here is the motherboard of everything. It controls all of that, so it controls your hormones as you grow up. Okay, so this happens to do with the menstrual cycle and all that, women's menstrual cycle. Alrighty. Viewer discretion is advised. So, in case if a young girl is watching and she starts getting scared, like, oh my God, is this something that I have to look forward to? This doesn't happen in everybody. Again, also, we're going to be saying some things on here. So, if you don't feel comfortable with it, that's okay. But this is knowledge that we're going to make it age appropriate and it's not going to be anything vulgar. Alrighty. So, we'll just talk about your period. Again, like I said, your menstrual period, girls start going through puberty because the female body reproductive system, primal need is to have a baby, to get pregnant every month. When you get to around age 8 to 9, they start going to puberty. You start seeing the breast forming, and it start getting body hair. And then around like age 9 to 10, 11 ish, that's when most of them around 10, 11 is the average age where girls go through their period. It's when the body, the brain tells the ovaries and all that say, okay, we're getting ready. We're getting ready to start going through childbirth and all. So let's release it. Let me make this a little more clean. Alrighty. So when it gets there and the brain tells the thyroid system, okay, we're ready now. The body's about to have a baby. Okay, so this month, the ovaries releases the egg and it goes in there. there would not be any sperm because again, she's turning 11 years old. She shouldn't be at that point. Okay, so and then when there's no egg there to meet the sperm there to meet the egg, the body's like, okay, we're not pregnant. Get rid of it. So when you get rid of it, that's when she sees her period. Her first period comes on, and then it comes on every month until she reaches menopause. And usually that's the way it's supposed to work. Some people have little aches and pains here and there, and some that means other people have like really bad pain, back pain, sometimes nausea and vomiting and all. Of course, you're going to be following with her pediatrician also during this time. All right, but other times some things happen. There's so many different menstrual irregularities and things that happen with the menstrual cycle. Okay, so and that can cause a problem. So PCOS is polycystic ovarian syndrome. All right, so basically it affects 1 in 10 women of childbearing age, and most of the time it goes undiagnosed because sometimes you go and they just give you some medicine and say, okay, you're fine, you're fine, you're fine. So let me just go do a little bit of I'm just gonna go in here and change my go and give you some background knowledge there. Sometimes the pictures don't come on. Alrighty, so I move this around. Alrighty, anything you want to add, Julie, while I'm doing this? Let me do the, but
Um,
I'll do the anatomy first. Okay,
okay.
so all right, so this is the female reproductive system. Okay, these are the ovaries here, right here. I'm doing that. When you're watching this later, you can slow it down and watch. Okay, it is over here. There's one on each side. It's right below for a female. It's like below your belly button area, in your almost like in your thigh area. Okay, so this is the ovaries. This is where the eggs are released, and then when it comes over here, it meets the sperm. And if you get pregnant, it happens here, and that goes. And then if you don't get pregnant, it goes away and it starts again every month. So this is basically, I'm not going to go through all the many different parts. Okay, so when that happens, that's how it's supposed to happen. That's the anatomy there. Okay, and then it just comes out. You have your period, and you go the next month again. You don't get pregnant, it comes back again. Alrighty. So, but sometimes when you sit in there, and sometimes you miss your period, you having period maybe 2 or 3 times a month, or you're not having it at all. So usually that's when it'd be like, okay, what's going on? I'm supposed to be seeing my period. I'm supposed to see every month. You told me I'm supposed to see every month. What's going on? Usually, if that child goes to the doctor and all that too, the first thing we're gonna do is to make sure we get a pregnancy test. All right, and don't say, "Oh my God, my daughter is this," and then you do, it's not because any we're not it's not passing judgment. It's just basically saying that okay, she's not having her period. We want to make sure that she's not pregnant first, because you always want to rule that out, regardless of whether she's 10 or 25 or 35. You want to rule that out first, okay? Because also sometimes people who play sports, girls who play sports and all that too, don't see their period for a long time. So we want to make sure we rule that out first. Alrighty. So again, going back, like I said, it affects 1 in 10 women of childbearing age. All right. One of the symptoms of your what symptoms were you having, Julie? So I can go through that.
Um, yeah. So I got my period about 10 years old. At 10 years old, and when I first got it, I was getting it every 2 weeks. So I was getting it more frequently than I should. As I got a little bit older, about 11, 12, it did even out to about once a month. When I was getting it, it would last for about 7 days. It was very heavy, lots of clotting, lots of cramps. I would get very nauseous. Sometimes I would vomit. The nausea was so bad. Any little smell could trigger me. It was very intense, and it was very painful thing that would happen every month.
Oh,
Um,
wow.
but that didn't lead me to being diagnosed. I didn't get diagnosed till I was 35, because at 35 I started to get my period then once every 3 to 4 months, which was unusual. And when I went to the doc, they said it was as long as you're getting it every 90 days to shed the epithelial lining. Otherwise, you're at risk for some sort of cancer.
Mhm.
And then it would go longer. It was going 5, 6, 7 months. And that's when they put me on progesterone. I took the
Is
progesterone
there
for 10 days, and then I would
is
bleed
there
for
a
two
reason
weeks. So
why?
that was horrible.
Is there a reason why you were using your GYN? The GYN is a gynecologist. Is there a reason why you weren't discussing that with the GYN prior to age 35? They
No,
didn't
like
think
I
to
would go, like I would go for my yearly checkups, but it wasn't. I'm going to be honest, like women's healthcare is lacking. And I'm older, so we're talking 20 years ago, where there didn't, nobody ever really said anything to me like that was not normal. Or I don't even feel like I was asked about like the symptoms of my period. You know what I mean? Like I just would go get my pap smear and move along, like, because I never got pregnant or anything. Um, and
Okay.
then at 35 when it started becoming more irregular. And I went through like 4 different docs to get my diagnosis. So, because I
And
felt like I wasn't getting answers that I wanted, because they kept working all the labs, doing all the tests and saying, well, you're fine. You're fine. I don't know why your period's the way it is. Um, until I started bleeding then for a year and a half straight. And at that point, I felt like I gave up hope going to doctors, be honest. No offense to anyone. And then I went to a GYN that was recommended. You should check him out. He's good. I went. And when I first made the appointment, they had me with a nurse practitioner. And as I'm telling her all my symptoms, she's like, hold on right there. I'm going to get the doctor. And then they got the doc. And apparently this doc, he deals with only women with issues. Like he specializes in people with issues. And
okay.
he's the one who ordered me an ultrasound and testosterone tests and all that stuff, and found my testosterone levels were elevated, that I had a thickened uterine striaea from the ultrasound, because they didn't just do a regular ultrasound, they did a transvaginal ultrasound.
Okay,
Um,
we'll get to the diagnosis.
yeah,
Main
yeah,
thing,
yeah,
right? Okay, so some of the symptoms you'll be asking will be facial hair. You see that sometimes they grow like a full beard and all that too, some mustache and all. I had to confess because I remember I had a neighbor that had facial hair way back when I was like, what is, I never knew what was going on. I was much younger. I didn't know what was going on. And it's like, I used to say, please don't let me get facial hair too, because I didn't know what was going on.
yeah.
Also
I
acne,
do have that.
do you have facial hair? Okay. That was one of
Yeah,
the telltale signs. Acne, rub acne, hair thinning. You losing your hair, but then you got hair, hirsutism, which is also hair, like the facial hair, and also hair on your back and on your chest area. Weight gain. The weight gain is like whether you don't know what it came before or after, but it's a
yeah,
result of. But you also get weight gain, and people are like, why don't you lose weight? Why don't you do this? Like, you can just eat healthy. And most times, it's really hurtful to people when it's not, because it's not one of those diseases where you just open your mouth and just telling people, okay, this is what I'm going through. And that's one of the things why I say people need to not weight shame people, because you don't know what that person is going through. Alrighty, because they be like, why don't you just eat differently? Skin
yeah.
darkening, skin tags, headaches, pelvic pain, depression, anxiety, and fatigue. Of course, that would be some of the
All of
reasons
the
that.
above.
Yeah. So you have all of that. Because usually there's like, and also it's like some people might say, I didn't have that. I had some of that. I didn't, so you can have 2 or 3 or more of that, but most of the telltale signs are like their body, facial hair, and also the weight gain and all. So some of the risk factors, did they tell you what your risk factors were? Did your
Yeah,
any family?
with the I had all of those symptoms. Acne not so much anymore as I got older, but all the other things, yes. With it causes metabolic syndrome, so there is health risks from the metabolic syndrome and the insulin resistance, which ties in with the weight gain.
Okay. So the risk factors, again, it's a excess weight. So, but it's like, okay, excess weight, is that before, or after? Also, lack of physical activities, family history of diabetes, and also PCOS. Most of the time, if you have PCOS, you have a first degree relative that also has it too. So, mother, sister, and most of the time, your first degree relative. So, most of the time, it's like, and then also it says because your mother may have been whatever, and what she was exposed to she was pregnant with you. So also seeing your period at a very early age. It's one of those things where you have no control over. If you had your period at a very early age, and early meaning like around before age 9, so because some kids just get it. And if you do have a child that's getting the period way before age 7, 8, and all that, and start developing, please bring that to the pediatrician's attention, because that's precocious puberty, and that can also have other effects too, orthopedic effects. I mean, your bones, you don't want the bones in your hands or your feet fusing and all that. So that's a different topic, but also part of that too, because there will be seeing the endocrinologist too. All right. So most of it is like, again, like I said, and genetics play a major part, meaning 20 to 40% of women with PCOS has a first degree relative, like I said. Okay, so the diagnosis. And PCOS is a diagnosis of exclusion. So they have to work out and get rid of all and say, okay, this is not this, this is not that, this is not this. So sometimes the reason why they'll do so many different tasks is because they have to rule out so many other ones too. Okay. Let me see here. Okay. So going on there and let me see here. So some of the no two women are alike, and sometimes the diagnosis can be a little frustrating. And sometimes you go to different doctors and they tell you, okay, this is what's going on, this is what's going on, and you feel a little frustrated, like you were saying. You have to go to so many different doctors before they can finally diagnose you. Or sometimes some doctors don't talk about it because when you go see the GYN, sometimes they're like, "How you doing? I'm doing okay. Seeing your period? Yeah, I see my period. Oh, I didn't see it." And when you're younger too, your period's not always regular until you maybe as you start getting older. So sometimes the GYN might say, okay, well, you're like 12, 13, your body's still getting used to it yet until that happens. And then you find out that, okay, there's something else more going on with that. So the two telltale signs, okay, like I said, diagnosis is let me come in here. I think I was supposed to do here. We did the treatment, so the diagnosis, okay. Irregular or absent periods, already. So you don't want you go in and want as if you're not sexually active, okay, and you're not using the birth control and all that, you're supposed to be seeing your period every month. So irregular or absent period or no period at all, or absent period. Tell them about the transvaginal ultrasound because the ultrasound you can do that. They'll put a little gel on your belly and closing down to your private area, and they can do that. But the
Hmm.
best way to do it is the transvaginal ultrasound. So warn them about the transvaginal ultrasound.
It's very uncomfortable, and I was bleeding, and it increased the amount of bleeding and cramping I had post ultrasound. So just be forewarned for that. It is, but it was with a female tech. It was in a private room. They had a bathroom attached. So I will say the place did nice to provide as much comfort as they could. But it is kind of awkward but it goes quickly. It's like over in like not
Yeah,
even 20 minutes. I don't even think that long. Probably
yeah.
was like more 5-10, but felt longer.
It's and so if you are out there and you have to do ultrasound, they tell you how to do transvaginal ultrasound. I had it done too because I had fibroids and all. First time it's done is like what whoa,
Yeah.
you know. So if you
Yes.
have to do that, tell them and you make sure you want and you feel comfortable with a female tech and all that. Ask them about it, and if you're going in with like a young child because you can't find babysitter and all, chances are more than likely you probably want to leave that child outside or somewhere. Okay, if it's a very young child, that's fine. But if you have like your no, just leave them outside and all because it's you don't want to have that. Okay, so some of the diagnosis, like I said, they do that or they use the Rotterdam criteria. So you can go into absent irregular periods. And when they do the blood and they do the blood test, your androgen, like you said, do your androgen because that's the male hormone. And usually when your body makes a lot more male hormone than female hormone, it stops you even having your period. So that's one of them. And then when they do the ultrasound to find in there. So let me just go and close this up here for a second. And then if they do the ultrasound and they go in here and that's they see all the many cysts, poly, many, and all that too. So the different cysts and follicles on the ovary. Usually when they see that and it's like up in them right away, that means you have you have PCOS. Okay, so that's when they start you on the treatment. And also when you go see some people follow up with the GY with their family doctor to do this, and sometimes people go to the GYN in places like again, like I said, I really wanted to bring somebody on from back home too who was talking about that in places where you don't have so many specialists running around, not running around, but you don't have too many people like that. You have to follow up with your GYN. You follow up with your PCP. Okay. So, and also when I started all this too, right after the pandemic, most of the specialists were available. Like if you went to go see your GYN, the first thing to call first, are you pregnant? No. Okay. And if you're bleeding heavy, go to the emergency room. But we'll see you in 4 to 5 months from now. So imagine if you had that problem, your family doctor was going to be taking care of that. Okay. So I was doing most of this stuff and all that, seeing patients that had issues like that. We had to do the blood work, and eventually I said, okay, go on to go see the GYN. So when you go see the family doctor, we'll do the full physical. We'll look for the body here. We'll look again for thinning hair in the head. We also going to be doing the blood work at the same time too. We're doing your history and physical, asking about your family history. So what made you go and see Nate? You said when you were 35 years old. What was the main thing that caused you to want to go?
My period wasn't coming every month. It started to come every 3 to 4 months. And then the first doc put me on. At first, she was like, it's fine as long as it's coming every 90 days. And then it started to get longer, like 4 or 5 months. So I followed back up. And then they started to put me on progesterone, which you take for 10 days. But then after I would take it, I was bleeding for almost like 2 weeks. I was like, well, this is worse, you know. It was like, and I didn't like, they did a slew of labs. They said your thyroid's fine, everything's fine. You know, we don't know why your period's being the way it is, you know. So I had switched docs again at that point. And then my like period was, then it was coming, it just didn't stop. I got it straight for a year and a half. Like I just was, it was constantly, I was constantly bleeding. I was passing out in the shower, feeling weak, you know. And so then that's when I got the follow up with the next doc. And I was working a lot and stuff, so I was just ignoring it and just like busy in life, you know. So, and at that point I had given up hope because I didn't know like anything was going to happen. So it wasn't until I went to the last doc that they ordered all the testing. So like that's where they found the elevated testosterone level. When they did the ultrasound, they found not only cyst on my ovary but my cervix also, and a thickened uterine striae, like in the ultrasound. And that's what, and I had all the characteristics. Like I had facial hair, I had overweight, I had metabolic syndrome. Even if you break down my cholesterol, which metabolic syndrome means you have elevated high blood pressure,
High
elevated
cholesterol.
trilipid levels, and
Yes.
insulin resistance. So I had the insulin resistance, but my A1C was good. So I wasn't technically diabetic. But I had like elevated, if you looked at my labs, like my LDL wasn't bad, my HDL wasn't bad, but my triglycerides were really high.
Very
Um,
low.
so yeah, so, you
Were
know,
they,
being,
were they concerned and for pancreatitis too? Because you're trying for
yes,
low
yeah,
high.
yeah.
Okay.
And I was someone who would always get nauseous after I ate, or like want something sweet after I ate, you know, to help the nausea, things like that. Um, and even once I got the diagnosis from my doc, it was my PCP who managed the symptoms. She's the one who put me on the metformin. She put me on blood pressure and cholesterol medication, and, you know, like checked my A1C and all those things to like, you know, rule out diabetes. They did the urine diabetes test. I still do that every year to make sure it hasn't, you know, and I still get my A1C checked every year to make sure it hasn't gone up. And I've lost weight recently. And because that's what they basically recommend is diet and exercise, high protein diet, low carb, you know, lots of vegetables, you know, lots of like whole grains, whole fiber grains if you're going to eat carbs. So I've lost weight and changed the way I eat. So I found that with that, my cholesterol's got much better. Pressure is much better. My A1C is like 5.7 last time I checked. So like all those things are more
Ooh,
regulated now. Yeah.
good. Good, 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 good. And most of when the weight gain, so because the weight gain is mainly around your belly area, which makes
Yes.
makes you high risk of getting all the metabolic
Rest.
syndrome and all that. That's why when I talked about high blood pressure and also high cholesterol 2 weeks ago, I talked about PCOS being one on the causes of that too. So you have to, it's like, what came before first, but usually as you're a younger person, you get older, that happens. So it's important to, yes, you're watching your blood pressure, you're doing all that. And I know your PCP and she was very good. So
Yes.
is she still your PCP?
Yeah. Yeah. You could say it.
Oh, okay. Okay, she yeah, she are good. Alrighty. So the treatment again, like depending on the severity of your symptoms, again, no two women are alike. So and the complications and all that. So your doctor, again, we do the history and physical and we do everything else and we can determine okay, this is what we have to treat. So basically, like you said, your weight loss, if you have to do for a hair removal and all that too, did you go to the what they call them? People like
Laser
electronics?
hair removal. You
Oh,
can.
yeah.
It's
Yeah.
expensive, but it tends to grow back with hormonal hair growth.
Okay,
So
what
that's
they
the thing about laser hair removal.
what happens? It goes back
It tends to grow back. Like it doesn't have a lasting effect the way it does like with hormonal hair growth. So it's
okay,
something you got to follow up on.
already. And
So
also
it's
there's a
it's
special
something you got to consider cost wise if it's something an option for you, because it can be very costly.
there's also a special claim too. And also would the insurance company pay for it if you go in there because of that? Was it covered
Mine
again?
did not.
It
Mine
didn't.
did
So
not.
they don't do the cosmetic part of it. You would think they would do that. You
Yeah,
know,
but they're insurance companies, so
yeah, well, women's health, so okay. So also you're getting hormonal birth control. They'll put you on the when it has the progesterone, they just want you to make sure to have your period and all.
yeah,
And like you went from like not having period regularly, no period to like having a period, like just like okay, no,
constantly.
you just open up the woodwork. So and because of that. people out there, if you on oral contraception, I just also have to add that it's oral contraception. So that doesn't, if you're having any kind of sexual relations with somebody you're not committed to, also it doesn't protect you against from HIV and other sexually transmitted diseases too. Alrighty. So make sure if you're doing that, don't just say, "Oh yeah, I'm good now. I can do that." No, no, no. You have to make sure you use other barriers too. So they can also put an IUD into that can kind of regulate your period, vaginal rings, and different injections like a Depo-Provera that can also kind of help with that too. Okay, they can give you anti-androgen drugs. Did they give you? Did you have to be on spironolactone?
Never did the spirulactone, but I've heard that's helped others. No, they did a DNC, and then now I'm on the Lolo, and that's I with the Lolo, I don't get a period at all anymore. If I
Okay.
do, it's like minimal spotting, like around that time, if anything.
Okay. Good.
Yeah,
All right.
but I
So
started to get some swelling in my legs, so maybe spirulactone is something I should talk to my doc about.
maybe that actually helped too because it's anti-androgen and
But I
actually
know
helps.
the spironolactone tends to be more for like acne control and stuff, and I think
Yeah.
I wasn't suffering so much acne as I got older, so
Yeah. Yep. Okay. Good. Good. And again, hello, you did glucophage. So some of the alternative treatment, if you want to do is like natural treatment, like I always tell people, if you're gonna do alternative treatment, make sure the complementary treatment you go into it's called complementary and alternative medicine. I talked about that before. And coming from back home and all that, most of us is like everything you're using, you can use this potion, you can use the lotion, you can do this, but make sure, especially if you're doing something that's that's something that's unique to your culture. Make sure you write a name down somewhere. Look for the scientific name. So, God forbid, if you have any kind of allergic reaction, when you go to the hospital, they can say, okay, let's look this up and say, maybe that's what's going on with her. Don't just say, okay, I'm doing this because I can name 10,000 things that we did back home that if I don't know the scientific name and I go to the hospital and they give me a medication that may interact with it or something else. And because, again, they will be treating you with Western medicine. So, if you go into somebody who's going to be doing alternative treatment, make sure they have information, not just Western medicine, but medicine that's like known where every other doctor can just open the book and look at it and say, okay, this is what we're looking at. Alrighty. So basically, did you do any acupuncture
I
or
did.
you did
I did,
acupuncture?
and it did the acupuncture did help with I was doing acupuncture back when I was very irregular to help with like making my period more regular, help with cramps, help with like the painfulness of my periods and things like that. It did help. She also would give me herbal supplements to take, so always cross check those with any other medication you're on if they do provide or prescribe, you know.
Okay, so then there's also Chinese herbal medicines, and you
Yes.
did some supplements also. Did you do any yoga or Tai Chi and
I did
meditation?
yoga. Yeah, so
Yeah.
yoga really helps with stretching with I did Pilates. Pilates was a good way to strengthen my core, and when especially being an overweight, if those muscles in your core are weaker, it can lead to more intense cramping and whatnot. So it helped with strengthening those muscles around my core and hip and abdominal area. That helped with like, help reducing cramps, the painfulness of cramps, whatnot, and it
Mhm.
helps with like getting the fat off, like burning fat because you're insulin resistant, so the more you're able to build muscle, you're going to burn through more calories and like a boost your metabolism. So those are nice ways to introduce yourself into exercise if you're not ready for cardio yet.
Did you wait? So were you exercising, like walking in the neighborhood, or did you go to the gym, or just basically?
Walking and doing like more isolated like leg lifts, squats, things like that, more like calisthenic type of exercises.
Mhm. Good, and it's important. And how was your mental health during that time? Because I can just imagine things. That's part of
Horrible.
the I mean,
It was
that's
horrible.
the
Yeah, I
same thing
was depressed. I was
afterwards. Go ahead.
no, go ahead. It was, it was depressing. It's frustrating. You always like, when you feel like you have your period, you don't always feel like clean enough. You always want to get another shower and like, you know what I mean? So you just like it starts to wear down on you that you always feel like kind of frumpy and you just want to be in your cozy sweater and not go out and do stuff. You know what I mean? So like at that period where I was just continually bleeding, it was horrible. Yeah, it does start to cause you some depression and anxiety. They did prescribe me something, but I also had like a lot of other stuff in my life going on too, you know.
Mhm.
So they did put me on Lexapro, which is for anxiety and depression, and I feel like
Yeah.
that helped tremendously.
Okay. But was it your primary care doctor that did that, or did you
Yes,
have to see? Okay. already. So again, like I tell people, most of the stuff we have to handle in primary care because, and again, we can handle that too. So it's even when it gets more than that, and we can say, see, but again, like I said, to get a therapist, you could be waiting for a couple of years. So, but we can do that in primary care as well. All right. So some of the complications that we talked about already, we talked about diabetes already, and we talked about high blood pressure. If you missed my high blood pressure show, please go back and watch that. I talked about high cholesterol. I did a high cholesterol show also. If you missed that, please go back and watch it last time. And did you have any problems sleeping? I can imagine that one of the
Um, yeah, because I would get it almost felt like I was like going through menopause. I would get a lot of like night sweats, insomnia, a lot of trouble just getting comfortable in bed, like because I'd wake up like sweating like crazy, and then I get chills after, like almost was getting like hot flashes and stuff before they got me on the dose of birth control I'm on now. With the birth control I'm on now, I'm really regulated. But before that, it was horrible. I almost felt like I was going through menopause, like in my 30s. Like,
yeah, listen to me.
yeah, like I was like the hot flashes. I felt like my body was the sun, and I was radiating heat out of me. Like I would
Mm.
just like feel like I would heat up from the inside, radiating out, and then I would start sweating. Like I always
And,
felt
and
like I
hot
was on
flashes.
fire.
Yeah, hot
Yeah,
flashes, like, it feels like, I always tell people it feels like, when you're getting sick, your body takes a little while to heat up and then you get a fever. Well, hot flashes, like your body just said, oh, guess what? Let's just put you on, 103 degree right now, like that
yeah,
fast. And then and then your body, when you have a fever, your body slows down until your fever finally breaks. But then menopause, it says, let's just slow down right away. So you're basically go
yeah,
from, oh my goodness, I'm like so hot, get all this blanket off me. I'm sitting there, and then next thing you know, where's the blanket? I'm freezing.
yeah,
Basically, so it's like going through that. And then when you're young, going through that, that can be very, especially when you're sitting around people, or just even if you're sitting by yourself, it's just your whole body, because it really affects your body. And when you don't know when you're getting it and all that, that can really mess with your mental health. And I always tell people to, most of when you're dealing with chronic diseases, I talked about the fact that it does affect your mental health. And people just think, okay, well, you look good, you're okay, you seem to be handling it okay, that's good, but they don't know all the things that you go through in your own personal time by yourself. So that's why I always, when
exactly.
the patients come in, I'm like, how's your mental health, how are you doing? Because noise may not be, be like, oh my god, don't tell me I'm depressed. No, nobody's saying that. But when you start giving different answers and all, then I know that something's going on there. And sometimes it's like, oh, I don't want to take any medication for depression, I don't want to take any medication for anxiety. It may just be, I tell people, it may just be episodic. You may just need this, your body may just need this until you finally get to where you're okay, and then we can take you off it. There's nothing wrong with that. It
Yeah,
seems
and
like, go ahead.
yeah, no, you're right, because I was one of those people who fought taking something, thinking like, oh, I don't need that. I'm fine with that. I don't want that. And even as a professional, like I still was like fighting to take it. And
Yeah.
then like I had a breakdown at work, and the one girl was like, "Oh, you need to be on Prozac or something." I was like, "I can't take that. I'm a nurse." And she's like, "Oh, that's ridiculous. I've been on Prozac for 20 years. There's nothing
Yes.
wrong with it." And I finally took it, and it like made such a tremendous change, like in everything. And I was just like, "Why did I fight this for so long? Why didn't I do this sooner?" Like it really helped me with everything, you
And that's
know.
important. Yeah, important for people who are, especially people in the health field, people who are in the, who are in the psych field and all that too. It's like, you have patients. I'm like, yeah, you probably just need to just take something for now. It's not going to kill you. Go ahead and take it, and when you don't need it anymore, you get off it. Or maybe you have some chronic issues and you need to take it. I mean, the same way, like I say, if your knee hurts, you're going to take the medicine. If your brain hurts, you need to take the medicine. It's not a saying that you're weak, or you're weak spirited, or you're not strong enough to be able to like battle this, but your body is like basically turning against you, and you need to get yourself back in balance. Right. So if you again, like I said, when you go to your family doctor, make sure you write all these things down. So when you go to your family doctor, so when you're sitting in the room, because again, 15 to 20 minutes in the room there, you have to be able to get your questions and your answers out quickly as possible. And sometimes you don't want to get back out and then forget that you something you were supposed to say, something really important. For me, usually people used to call back and I say, okay, yeah, I'll talk to them, or they'll just put them back on for telehealth, and I talk to them the next day. All right. I didn't do any GYN of visits in primary care. I did that all when I was doing my student thing there. So I did like about 250 and pap smears. I was really good at it. So
Wow.
also, yeah, it was like, because the doctor I was with, he had so many patients, so I was like back to back, back to back. It was like, So and other I told about the mental health and then also endometrial cancer. So go ahead and
Mm.
explain that too. I can
Um,
go ahead.
I
The reason why
so far I've been good. Yeah, but it's still important to still get your pap smear every year to check. I know after 40 was it, they told me I only needed every 3 years. So, but
yeah.
still because I had no family history of it. We don't, my grandma was an orphan, so we really don't know what our family history was beyond that, you know?
Mhm.
Um, so, but it's important, and I never had any irregular pap smears my whole life. So you know, they'll tell you how often you need it, but it's important to get that done and get that checked to make sure, because if you're not having a regular period and you're not shedding that lining every month, it puts you at a higher risk for the endometrial cancer.
Mhm. Mhm. Alrighty, so those are the something. And also, when we get to PCO and pregnancy, alrighty. So some it also affects your pregnancy, so getting pregnant because you again, like I said, going back to what I said from the beginning, when you see your period every month, your body it's like okay. Chance to get pregnant, give you another chance to get pregnant, another chance to get pregnant, another chance to get pregnant. But if you're not seeing your period every month, then it's like okay, you're not ovulating, so the eggs is not coming out, and that means you can't get pregnant. Usually, they tell you go for like a whole year and see, okay, if you haven't had any success in a whole year, then that's when you want to contact your GYN also. But if you already know you're like a PCOS and all that, so your GYN, your OBGYN, the obstetric and gynecologist, will be also telling you ahead of time, okay, these are the things that may happen. Okay, this is a disease process and these are the things that may happen as you get older and you plan to get pregnant. Okay. So when you start having issues, when you get in a relationship, you start having issues with getting pregnant, then of course, these are the things. So some of the problems they have affects the health of pregnancy. It's also, critical to work with your healthcare provider too. Like I said, it causes miscarriage, usually the pregnancy loss before 20 weeks. That's 4 months. Also gestational diabetes, all right, because you also going into the pregnancy, you already overweight and you have the fat around your belly area that then when you get pregnant, the extra fat that comes along with it, that puts you at high risk of having gestational diabetes. And some people go on to their gestational diabetes is pregnancy diabetes. Then some people go on to that to developing type 2 diabetes later on. Also, gestational diabetes can be very dangerous for the baby as well. So you'll be going to see your OBGYN every month and it'll be managing your blood sugar and all of that. And also preeclampsia that can really high blood pressure when you're pregnant, so that can also be very dangerous too, because usually by then they're like, yeah, you have to do like emergency c-section to get that baby out of you there before you have a stroke or something happens to the baby. And also again, you may end up with having to have a c-section because when your blood pressure is really high and you're there and the baby's heart rate is going low and your blood pressure is going high, they want to get that baby out very quickly. All right. So also C-section, anything kind of surgery comes with complications too, but they want to get that baby out. So PCOS can cause that. So if you're having any issues getting pregnant, they do have medications that can kind of help you get along. All right. So it also affects the baby too, because the baby can also have issues with you get out, the baby's like sluggish when it's born and all. So you want to do that. So make sure start talking to your doctor way ahead of time if you plan on getting pregnant sometime and say what are the things that I need to do to get healthy, to put myself in the position to have a healthy pregnancy and have a healthy baby as well. Alrighty. So we talked about the diet, right? Were you on the you said you were having mostly grains and fiber foods and all?
And high protein, that's the other thing that a lot of people, they really recommend like 20 to 30 milligrams of protein per meal. So they
Mhm.
say like what is your optimal like BMI, that's how much protein you should be getting a day. So like if you're 5'5" and depending on your age, you should weigh like say 140 pounds, like you should be getting that many grams of protein a day. So like make sure you're not just protein from one source, like not just meat or whatever. Like there's other, you can incorporate like Greek yogurt, which is high in protein, as a snack instead of, something else, or like nut butters, and like if you're making a smoothie, protein powder, things like that. So like make sure you're getting enough protein, hydration. If you're going to eat carbs, the idea is if you eat a high fiber content of the carb, it digests slower, so it regulates your blood sugar better. So if you eat a piece of wheat bread that has 4 grams of fiber in it, a slice, as opposed to white bread, which has no fiber in it, and it's, when you eat those simple carbs like white bread, white rice, regular potatoes, your body's just going to digest it, your sugar's going to spike, and then you're going to crash. and then you get that like sleepy exhaustion like after you eat where you just want to nap. Whereas if you're eating foods higher in fiber or carbs with fiber in it, you're going to digest slower, you'll have better energy, your energy will be more time released, your sugar will break down more evenly, so it helps fight that insulin resistance and fatigue you get after you eat. So, brown bread, brown rice, brown, whole wheat pasta, sweet potatoes have more fiber than regular potato. Or if you're going to eat a potato, like eat the skins. Um, Things like nuts like are high in fiber and protein, so like that's a good snack. Eat healthy fats, so avoid the coconut oil or the butter, use things like olive oil, avocado oil, lots of vegetables. If you're going to go for sweet things, like a whole piece of fruit is better than like say juice, because a whole piece of fruit has fiber, it has vitamins and minerals and things in there that like just juice is pretty much straight sugar. So it's strategically like making sure you're eating regular meals. Like a lot of people eat one big meal or like two regular meals. Like make sure you're eating three little meals with a snack, or even six small meals. You want to eat more time released, eat more smaller meals more frequently, because it boosts your metabolism. Because if you eat just like one big meal, it almost puts your body into starvation mode, because it's like saving all this energy because it thinks it's not getting more food around the corner. But if you're eating more smaller frequent meals throughout the day, your body's always getting some intake of calories. So like, I was like I might have a shake in the morning, and then like some Greek yogurt for a snack, and then like a turkey sandwich, then maybe like a small salad as a snack. Like you want to break it apart. You don't want to eat a lot in one meal. You want to break it apart and eat more frequently throughout the day.
And
So
so basically, if you somebody who work outside of the home, you want to prepare your meal so you're not just eating on the fly or just ordering out and not eating something healthy. Is that easier for you, basically?
yeah, and you can they make, I don't know about, like I know here in America like they have like little, like Chobani has little yogurt shakes you bring with you, or like Crustables, they're like little peanut butter jelly sandwiches you can buy and just bring with you. There's like options of like cheese sticks like as protein, like you can bring snacks with you so you can, always make sure you're not dropping.
Mhm. So okay, so let me go in here, and then you want to stay away from your alcohol, refined carbohydrates, like you said, that your red meat, saturated fats, and all that. And also the DASH diet also helps to, like I said, the last week dietary approach to stopping hypertension. That's the DASH diet. So you guys can go in there. Again, I tell people I'm not trying to say stay away from the food, your regular food that you eat in your family and all that. You can incorporate all of that into your diet. And it's, but especially if you have a disease process going on, which is like mostly everybody, because everybody I know or know somebody who has high blood pressure or high diabetes, high cholesterol, start incorporating some of these healthy things into your diet. Okay, I know I don't eat that, this is what I eat, put it into your diet. Okay, so that way, because you want to be healthy. And in this case also you want to be healthy, because this is something when it starts in your childbearing years, like in your teenage years. Because most people, when they really start going through it, they start getting diagnosed early in their, like maybe the late teens or early 20s. You're talking about like almost like half of your lifetime of going through this. So it's very important that you adhere to like safe practices and also adhere to your doctor stuff. Now you don't have to like have a boring life and not do things you're supposed to be doing. Like me, I love Werther's Original, the soft chews. Oh my god, it tastes so good. That's that used to help me when we came from the hospital during COVID. I'm like, where is it? And ice cream. Oh, yeah, okay. It's like I keep telling people, yeah, it's all that COVID weight. They're like, it's been like 3 years. I'm like, I don't care. Anyways, plus it's like stressful, especially being a provider. People don't know that. Okay, so what are some of the ways that you can support somebody with that has PCOS? So this maybe it could be your spouse, or you could be your child, your teenager, or friend. Okay, so some of the ways you can support some people. So make lifestyle changes with her, especially if it's your spouse. Don't sit there and be eating everything and just think, oh, this is good. I remember some people used to be in a hospital where like the family member will be NPO, and then somebody will come and visit and they have like a big burger eating in front of the person. It's like, really? You eat the
Exactly.
burger.
So rude.
So, like, don't do that. I'm saying, like, hungry, and you're saying, "Oh, yeah, you're getting ready for your test? Okay, yeah, okay. Let me just say here." So make sure if the person's going out to go biking or going to the gym or doing anything, any kind of activity, kind of work around with them because you don't want it to be like, and it's especially when you're in a relationship too, you don't want your spouse, you want your spouse thinking that, oh my God, he doesn't like me because I'm like this, or this person doesn't like me because I'm that, and all. So try to work around them. Okay. Learn about PCOS. It's very important to learn about it. Know all the ins and outs, especially if it's your spouse or your child and all that. So when they're saying stuff, you can say, oh, I understand. You may not completely understand, but at least learn about it. Learn about the disease process, which is some of the main reasons we're bringing this to you guys. Also, practice patience. Can you talk about patience, Julie? Practicing patience.
Patience with the person, you mean?
Yeah, practice patience with a person. Also for yourself too, though. Give yourself some grace,
Yeah,
basically.
yeah, yeah. Like be understanding
Grace.
with yourself, understand what your body's going through. Like don't beat yourself up if you feel like you're sluggish, losing weight, or if your body's not doing what you want it to. It's definitely a humbling process to go through, especially when you have a chronic illness and people will make comments about like whether you lose or gain weight or, how you look. And it's like, sometimes it's like, I didn't solicit those comments. I really don't need that emotionally today. Like just try not to, say those things to random
Yeah.
strangers, like, and patience with yourself, patience to no, you can only take it one day at a time. So it's almost like how they tell people in 12 steps, like you can only control what you do in that moment, that day. So if you have a bad day and you're stressed, eat some ice cream after work, don't beat yourself up over it. Next day is a new day. You can wake up and eat your egg white omelet with your fruit cup and start new and fresh tomorrow. So
Was there any support group that you went through, or you just
I did
basically
not.
there?
No,
Okay.
but my sister's a dietitian. She taught me a lot about the nutrition of how to manage it. She really did.
Does she know anything about a Liberian diet? I want to bring a
I
dietitian
don't know.
on.
I honestly don't know.
It's like because when so I'll be fighting for my life in these Facebook streets when I bring up stuff. Oh my God, you say we shouldn't eat our food and this and I said, no, I'm not saying that. I'm just saying you can incorporate some healthy things into it because in our community, it's like you have high blood pressure, you have diabetes, you have, hypertension and all that. You have, so it's like, come on, guys, this just try to be a little healthier. But
Yeah.
so basically, yeah. So also like I said, there's so many support groups out there. You can go PCOS and go in there. There's so many different groups. You can ask your own GYN. You can ask sometimes the school if your child's still in school and all that, you can ask the guidance counselor or the nurse, and they have so many different resources out there. Again, like I say, your own GYN can do the resource. And if you want to go to the GYN and you feel uncomfortable saying I don't want to go to a male GYN, because you can always get a female GYN. Okay, there's nothing wrong with that. They both are the same way, but some people don't feel comfortable going with somebody who is of the opposite sex. So you can always go with a female, and sometimes you can call it practice before you even join the practice and say, do you have a female GYN there? Okay, so and then go ahead and do that. Don't People are not going to say, oh my goodness, you're being sexist. No, some people feel comfortable doing this. Some people feel comfortable doing, especially when you're a young girl too. You want to get
Hmm.
somebody who's female, and also you can have somebody in the room with you. If you go to the female GYN, whether it's female or male, there will always be the nurse or the medical assistant in the room with you. You're never in
Correct.
the room alone with the person, so you can
Right.
feel a little more relaxed when you go in there and say, okay, yes, I want somebody. So there will always be somebody in there with you. Even when I was there and I was doing it with patients and all, there was somebody in there. My preceptor was there, and also the medical assistant was there. But there were times that she didn't have to be there because I was in there with them. All right, you can always request your own family member to be in there with you. They're not gonna be right to where we're going in. Okay, so they'll be back there. All right, they will be everything we're doing before we go in. Okay, so alrighty, and then okay, like I said, so many support groups out there, and please, 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 if you find yourself being depressed or anxious, please don't play it down. Please, please, please don't play it down. Okay, you may just need a medication for a while. You may again, like I said, there's so many other therapies. You acupuncture, you can do some tai chi, you can do some yoga, you can do some meditation. In addition to all the other things you have to be doing, eating healthy, exercising, watching your weight, getting your blood work done because you may have to do a series of blood work over a period of time. So make sure you're following up with that. It's a disease that, once you control it, it won't control you. Okay, I know people, you have to go to work, you have to take care of your family, you have to take care of yourself and all. So all of that, you just have to find a good game plan and say, and some days it's going to go haywire completely, especially considering the kind of field you're in and all. But just give yourself some grace. Okay, and especially, and this will go out to also my Liberian generals, not generals, Jesus, I'm talking like military rule, all the people who do healthcare in Liberia. And especially because, again, like I said, Liberia is the place where you don't have that many specialists and all. So most of this will be handled by the primary care doctor, and also that somebody who takes care of all of that. And even with that, you don't have too many Liberian doctors or people around there too. So it's important to all you people, all the politicians. Again, women's health is very important. All right, we can't say we love our women and we love our mom and we love our sisters and we do this and all that too, when you don't put all the money, you don't allocate money and money and funding and all of that and services to keep women healthy. Right? So I know, most of the time we're like, oh, something happens to you, it's like witchcraft and all, but no, it's not witchcraft. Okay, this is something very common. That's one of the most common gynecological, endocrine stuff too. So you will be dealing with their dietitian if you have to. You have to be, you have to go to the gym or you have to go exercise. So you want to make sure the place is safe for people to go walk. You want to have endocrinologists there so they can follow up with them, because it controls that. It's not just GYN issue, but your GYN can do it. And also your primary care doctor. You want to have a lot of primary care doctors around, PAs, NPs, doctors, and all. You want to have them around. So please, 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 I'm calling on you, all of you who are running for president. The election is next month and all. I haven't seen too many different health plans, and also, please, I am begging you. Women's health is very, very important. Okay, we can't sit here and say we love our women when we're not doing everything to keep them healthy. All right. So again, polycystic ovarian syndrome or polycystic ovary syndrome, either way, is very common. But so many things you can do to keep yourself healthy. The understanding of your family member, learn about this, and find somebody to talk to if you're going through this. Find somebody to talk to, even if it's a close friend or a professional person. Find somebody to talk to. Alrighty. So, any last words you have to add to before we go off, Julie?
No, I think you did a really good job of covering everything. Thank you for having me on. I
Thank
appreciate
you
it.
also, because I just want to just talk about it. I want to make sure I get a personal side of it. So thank you again for coming on, Julie. I really appreciate it. I'm
You're
probably
welcome.
going to be calling you on for CHF. We didn't do CHF yet. I did I did CHF a couple of years back, but it's like we need to like refresh it again because I'm sure there's been more studies and all. So thank you all for coming
Mhm.
on. Thank you all for watching. For those of you who are watching now, I say thank you. Please give me a thumbs up. For those of you who have not joined Abby Tyler's Healthy Living page, please click the follow button, turn on your notifications. I'm also on YouTube. And thanks to those of you who are watching me from Focus in Liberia too. For those of you who will be watching later, I say thank you as well. Thank you all for your love and support. I come on Tuesday night at 7 p.m. Eastern, and I do short videos during the week. So thank you all. Stay safe, stay healthy, and I'll see you again next time. Good night. Bye.